let's start at the very most basic, right? And it's for those of us, I guess, who have been involved with it or who are familiar with it, it might seem overly basic, but I think a lot of people out there, they don't know much. They hear scoliosis, that doesn't say anything to them. So what is scoliosis? Just said it's very basic. And then what methods of detection, let me say this too. When I say methods of detection, I think the one thing that most people probably know about scoliosis is, like for me, I remember going to the school nurse and they'd have us line up, and you had to like bend forward and she'd run her finger down your spine or whatever, like, okay, you're good, move on. That was the extent of it. And that's all I knew about it until, 30 some years later. And then we were dealing with it with my daughter. So I guess if you could go through that, what is it and how do we detect it now?
Yeah, so you're absolutely right? The most exposure most people have is sometime in high school with the screening physical that says something to the effect of, is this, are my shoulders level? Do I have any back issues? And if you fail the school screening, one shoulder's a little higher, you have a little bit of a rib asymmetry. They say, go see your doctor, and then they get x-rays, and that's kind of the extent of it. And we tend to think of adolescent girls that have mainly the most amount of scoliosis. At least that's kind of the general perception. But with your permission, I'd like to really boil down to the nitty gritty and just work at it, because I think that scoliosis is half seen and half unseen. And I'll get into that for a second. And then I want to then kind of go into why we do what we do to try and address it and where things are. So sure. Let me just kind of dive into it. What I'd like to do is I'd like to share my screen. And I'm going to see if I can kind of just walk you through a little bit about what it is. And hopefully this will become easy to understand as we kind of get through this over here. So let me just pull up the, yeah. So I'm going to go ahead and just kind of basically just walk you through these two pictures right over here. Can you see these pictures okay?
Yes, absolutely.
All right. So on this view right over here, you can see right over here, this right over here is basically, a normal straight spine. And this, I would submit to you, is more of a curved spine, okay? And scoliosis in some way is curvature. But the real question is how do we go from this panel over here to this panel over here? And in reality, there's a lot of ways of getting to it. But let me kind of get to it at its crux, and then we'll go from there. So if we really zoom into this area right over here, you'll see that these bones, these are each individual bones that are basically stack up, and these stack up. You get the idea. They all stack up sort of like in a straight sort of a line. There are nerves that go around it, right over here. Whereas these are sort of twisted a little bit. And so if we really just isolate one of these bones, all of these bones, they stack up like Jenga blocks, one on top of another. If they don't stack up perfectly well, you can have some types of shifts. But let me just draw in a bone over here. I'm just going to use my mouse to draw it in, so it may not be perfect, but bear with me. So this right over here would probably be the bone that would be right underneath it, that would kind of go sort of, this would be that block that we talk about right over here, right? This would be that block right over here. And this would be this right over here. That would be that area, right? So this is the bone. The black thing that I drew out is the bone, and you can see these two stacked. Now the muscles are responsible for holding those bones together and whatever linkages that are there. But if those linkages go bad, or if the muscles have a problem with holding it together, you can have one bone twist. You get the idea? Mm-hmm. And that twisting, look familiar? Mm-hmm. And that's the essence of scoliosis. Now, depending on how much that twist occurs and what's causing that twist, we have to then determine the treatments that we go to. But it's really just a corkscrewing, if you will, of the linkages of the spine. That's scoliosis. Now, you have different types of scoliosis. You can say there's congenital scoliosis, there's adult scoliosis, there's idiopathic scoliosis, there's traumatic. There's so many different classifications, but at its core, this is what's happening. And then the structures that are next to that are what's getting affected. So for example, next to these areas, right? I'm just going to go ahead and just basically just reset that bone right over here. Next to these areas, you can imagine the spinal cord goes and you have nerves that kind of go straight through that area. They go down and they come out to the side. You get the idea?
Mhm.
And this is sort of the nerve circuits that go, right? All makes sense, right?
Yeah.
If this twists and it gets those nerve circuits and it twists those nerve circuits or causes problems to those nerve circuits, people can have problems with symptoms that relate to that. And so that's a second order function of that twisting. This is when the twisting gets out of hand. So you have twisting and then you have twisting that gets out of hand.
Mhm.
See, if the twisting is under 10 degrees, we don't call it scoliosis.
Mm.
But if it's more than 10 degrees, we say, there's scoliosis. And then we think about the other effects of it. If it's just that the muscles are affected, maybe sometimes we use a brace. If somebody has a long way to live, or I'm sorry, is very young and they have a lot of growth remaining and they're starting to get out of hand, we sometimes do additional stuff outside of bracing. But that's kind of where that goes. Now, let me just dive into one more thing over here. So I'm just going to go ahead and clear this, and I'm just going to go ahead and just reset this right over here. Now, the twisting really boils down to this, okay? When you have a twisting of the spine, the way the spine really wants to work is it needs to stack and support our body. It supports our head over our pelvis, and it allows for us to have reasonable motion between our neck and our shoulders, our torso and our pelvis. That's kind of the areas where we move. So, and of course, this has implications for baseball, and we'll get into that. But I just want to basically just kind of show you this. I'm unfortunately going to use not a baseball analogy, but a football analogy, and please bear with me. This right over here, I would submit to you is almost like a football, okay? And this over here, I would submit to you, looks kind of like a goalpost. You get the idea?
Yeah.
And this is looking straight ahead. Now, scoliosis is when these don't quite line up. And if the head is off to the side, for example, then the gravity line is going to be different here versus here. And the muscles are going to work harder to bring everything back in. Now, look at this over here. This is a back view, right? Look at this over here. This is a side view. And look at the goalpost over here. See how much narrower it is? So that's why another version of scoliosis, again, not the typical version of scoliosis, but another version of scoliosis is when the head is stooped forward. So as people get older, if their posture isn't perfect, or if they have arthritis that affects those linkages, sometimes the head can be stooped forward. Let me show you that. And so if we go over here, so let me just go back into here. So if we have the regular scoliosis where you have this is the area where the spine has to stack up, but if they start to move out of position, we start to talk about different things, right? You get the idea. But if you go over here, this too is scoliosis. Instead of standing up straight, as the day goes on, if you start to do this, look at where that head is with respect to the pelvis. Now, here's the real deal. Sometimes it doesn't occur just in the side plane or in the front plane. Sometimes it's in the middle of those planes. And so it all goes back to that same issue of scoliosis is a twisting of the bones such that they're not lined up appropriately and everything else has to compensate. And when things start to fall apart, we need to do more to compensate. That may be more training, different types of exercises, different types of physical therapy, and different types of additional stuff. And sometimes when it starts to get out of hand significantly, and what your family member had is definitely much more significant, then you have to do a lot more. Because what was the way that it happened? You had to straighten it out to try and get the head over the pelvis and then lock it down.
Yeah.
So that's kind of it. It sounds easy. There's a lot of technical moving parts, but I don't want people to get lost in the details, because the reality is this is scoliosis at its core. It's a twisting of the bones causing the rest of the body to come out of kilter, and everything has to work harder to bring it back into kilter. And that's the real issue.
And, I noticed on the one, right, and you had mentioned if it's less than 10 degrees, we don't really consider it scoliosis.
Correct.
No need for treatment, right? And then,
Correct.
and I noticed on those, in our case, my daughter's curvature was in excess of 60 degrees, which is why
Correct.
she had to go through the fusion. But
Yeah.
obviously then there's a lot in there. Are there, and I'm sure that there's different percentages based on each of those, but where do most folks fall, as you're working with them, and where, as we go through these different stages, what are some of the more common treatments that are out there that people can undergo that can kind of help correct or mitigate some of the symptoms?
Well, so typically scoliosis under 10 degrees is, of course, considered no scoliosis. And so most people fall in this range. Very few people fall in this range. Most people fall under the 20-degree category. Very few people fall over the 50-degree category, at least at their initial presentation. And the way they present is important, because scoliosis by itself should not be painful. But if it is painful, that's a sign that maybe there's something else going on and we need to investigate it further. Because just a simple twisting of the bones should not be that bad. But some folks, it may not only twist the bones, but it may irritate the nerves, or there may be something that's either potentially growing inside of that area, like a small mass or something, or something that's causing the body to react to it. You get where I'm going? So sometimes it just doesn't, the end result is that the muscles have to work harder, but in between, there may be multiple causes to get there. You get where I'm going?
Yes.
So that's kind of what we're trying to understand when folks have a different amount of scoliosis. And see, we get fixated on the degree of scoliosis, and the degree of scoliosis just tells you it's like a smaller detail. The real issue is, do you have scoliosis or do you not have scoliosis? And then at what age do you have scoliosis? See, the younger your age of having scoliosis, like let's say you're 4, 5, 6, that's where congenital scoliosis tends to become more of an issue. Adolescent scoliosis is in your teens. You have a fair bit of growth left ahead of you. And that growth has to be contained so that the head is able to sit well over the pelvis. And that's where we sometimes think about identifying how much that scoliosis is progressing. Now, one of the smaller details is that there's a degree of error in measurement. So sometimes you have to take a couple of these x-rays over time just to be convinced and have it confirmed that the scoliosis is, in fact, progressing. So you confirm that, and if it is progressing, then you have to think about other things that you can do to try and stop it from progressing. If someone has a fair bit of growth left ahead, and there's nothing else that's causing the scoliosis, then it's possible to consider using a brace. And that's where the 25 to 40 degree thing comes into play. But these are not hard and fast rules. Remember, there may be somebody that it's in the 10 to 12 degrees and they're getting worse every 3 months. We may brace them sooner. So we're going to use these as general guidelines. But the reality is we want to understand the personality of the problem.
Got it.
Is it getting out of hand? Is it roughly staying the same? And, when you put braces on folks, it's nice to think of it in the abstract, but this affects their lives. It affects their identities. It affects what they do. Like it is a big deal. I don't wish scoliosis on anybody, right? Because it is a life-changing thing, especially when it gets out of hand. However, it is something that we have, if we're able to identify it early, typically in that 10 to 25 degree range, if we're able to get it at that point, bracing for those that have no other issues, like no other growths, no other causes, no other scar tissue on the spinal cord, things of that nature, we are amazingly effective by doing the bracing. Now, we're living right now in post-COVID era, and we have done such a disservice to our youngsters because we haven't been checking them for scoliosis. So I can't tell you how many folks have come to me because there was such a great awareness. Remember when we were in growing up through high school, there was a grade school, high school, there was a great awareness about scoliosis. That awareness hasn't gone away, but the checking of it has because of all the stuff that we've had of late. You got to make sure you don't have COVID. Your back can wait.
Yeah.
You get the idea? And that's the challenge.
So I guess in that, if we're talking, so just, again, in our own case, I think it was, so my daughter was born in August, and specifically, I remember it was at Thanksgiving. And we were just changing her, and I just noticed her in her back. You could just see, I was like, boy, something does not appear right. It looks like
Something
there's a curvature.
ain't
You could see
right.
it. Yeah.
That's it. That's you hit the nail on the head. It's something ain't right. That's all you need to know.
Mm-hmm.
My dresses, these just don't fit me right. My one shoulder seems like it's always higher. I feel like I'm always like twisting, like it's something ain't right. That's all you need to know.
Mm-hmm.
And then you can get to it, because it's so hard to, there's so many ways that it can present itself. And if somebody's really thin, you can see their bones easier. But if they have a little bit more meat on them, or if they're a little bit thicker, hard to see.
Mm-hmm.
So something ain't right is still the best advice I can give anybody to get it checked out, because really at the end of the day, that will help you potentially make a life-saving move, or at least a lifestyle changing move, because you don't have to go through a bunch of stuff to get that together. See, the challenge is that when the curve gets out of hand,
Mm-hmm.
let's say, unfortunately or fortunately, you have the curve, right? And if it gets out of hand, if it starts to run away from you, it can affect other areas, because the reason we talk about doing surgery on folks to really stop it from getting out of hand is because it can affect internal organs if it gets to be significant.
Mm-hmm.
And if you have scoliosis as a youngster and you had a brace and things were stable, you still want to get it checked out when you're an adult, because even though the traditional thinking used to be that these things don't change, in fact, sometimes they do. And it's better to catch it earlier rather than later, because you have more options.
Yeah. Well, so you had mentioned initially that the scoliosis in and of itself is not necessarily painful, but there can be some fallout from that. So what are maybe some of the symptoms, outside of obviously just noticing, and you're looking, you say, boy, something doesn't look right in the mirror, something doesn't fit right. Are there some other physical symptoms, be it, discomfort or other things that somebody might notice and say, gosh, I wonder if this is being caused by scoliosis, something with my spine?
Sure. Typically the answer is it is caught at that. My one shoulder is higher, my one pelvis is higher. That's it. That's the bulk of it. That's the easiest way to catch it. When it gets out of it, or if there's something that's affecting the nerves, then you have to think about some of the things that come as a result of nerve-related pain. Okay. So let me just switch to this right over here. Give me just 1 second. And I'm just going to go right over here. So if we go ahead now, this is looking closer to the lower back. We'll talk about this. If you take a look, this is a front view of the back, and then this is a side view and a back view of the back. And you can see right over here, these are the bones that are in the lower back. You get the idea. Now, if they're twisted and the nerves next to them are getting affected, you may get low back discomfort or shoulder blade discomfort, things of that nature. But if the nerves themselves are getting affected, then what will happen is that these nerves right over here, inside over here, are going to potentially get affected as there's more twisting around it. These nerves right over here are going to get affected as there's more twisting around it. You get the idea? Something going down like this way, or something going down this way. This is supposed to be an arrow. Sorry, I'm going to work on that, make that a little bit clearer. You get the idea, right? So if that happens, what can happen is you can get something like this, where those nerves can get jammed up, and you can get something like this. And so if you're starting to have symptoms that go something like this, or wrap around the rib cage, or go across the back, this is all stuff that can potentially get that together. Now, it's easy when the nerves are affected to say, oh, you know what? It's not my back. I think it's my calf right over here. Or you know what? I think I pulled my hip muscle. Or you know what? I think my ankle just has an issue. You get where I'm going? And so it's easy to miss it, because it's not all there. So what you want to do at that point is not make the diagnosis yourself, but to really go to a trusted healthcare provider and say, hey, listen, I'm experiencing these things. Are they related? Or are they not related? But having some idea will help you well, first of all, I'll convince you that you're not nuts because your pain keeps moving, right? Because
Right.
that's a big problem with this, right? And then the second is to have somebody to say, hey, listen, we got it. We're going to at least get it checked out. And then once we have all the pieces of the puzzle, because we do have to do some detective work, then we can say, all right, this is how it all works. And this is how I think we can get to the root cause of it so that it doesn't become a the domino doesn't get out of hand, right? Because what happens is you have a twisting, that's the cause, which causes the muscles to get irritated, effect, which then causes the rest of the muscles to get spasmed, cause, which then causes more pain, effect, which then causes you to go in a different direction, cause. And you can see how each cause becomes an effect, which becomes a cause, and then it can spiral. And our goal is to cut it down.
Absolutely. So, you know, and it's one thing, I suppose, if you're just, you know, just a normal daily activities, right? Might be some situations, as long as it's fairly minor, that you don't really notice that too much. But certainly with, you know, I've got a great interest in when it comes to sports, and we talk about baseball in particular. You know, it's a very rotational sport, right? In order to hit, in order to throw and pitch.
A lot of
how does something like scoliosis, how could that affect, you know, is there a greater impact for an athlete? Are there things that they need to watch out for specifically if they know that they've got any kind of you know, symptoms of, or maybe they're not symptomatic yet, but they know they've got scoliosis? What is the impact on athletes with this?
So let's take an athlete, right? A baseball pitcher, for example, right? Or in skill players. I mean, really, any position can be affected by this. So you have a slight rotation. You're an athlete. You have a slight rotation in your back, and it's causing you to have some intermittent discomfort, or maybe no discomfort, right? How do you know that this is a problem that's worth pursuing or not a problem that's worth pursuing? I think that's a very important question. And one of the ways I like to think about it is I like to use the analogy of quicksand. If you feel like the more you do, the worse you get, and even if you don't do anything, you're sinking, then you got to get it addressed. But if you're not there, if you're not like just getting progressively worse, then pay attention to the stuff. See, baseball, what I love about baseball is it's got a lot of stats. So you got a lot of feedback telling you if you're on the right track or the wrong track. You can throw 100 pitches and now you can only throw 85. You got something you got to look into. You get where I'm going? So pay attention to the stuff that you need to do. Because if that's getting out of hand, that's an issue. Now, why would that be? Well, let's go back to that twisting, right? You have the twisting, the muscles are affected. If you have a exhausted muscle and you add more load to it, what happens? That's it. That's how scoliosis affects baseball. So your spine, when it has a little twist in it, can be a little bit more fragile. Most people up to 10 degrees can handle that fragile area. But if you're a high level pitcher, or you're a high level batter, or you're a high level shortstop, whatever it is, right? You are playing at the extremes of what you can do. So you need every little bit. And so how do you then harness what you need to do? Well, that's when you have to get your muscles primed so they can handle this. Now, for scoliosis, it's slightly different than other folks because they're just a little bit more fragile and their muscles may be more prone to being fatigued. Again, we're ongoing on a fair bit of research about this. I'm giving you my own clinical experience, but I just want to make sure that we're on the same page. So in order to identify that, one of the things that's worked well for my patients in my practice, including baseball players, is to really focus on Pilates type moves. So not only core, but like, because I think of Pilates as almost like yoga with resistance, right? Yoga and resistance bands. That's the way I think of it. So it helps you know where your body is in space, helps you to be able to recruit your own unique pattern of movement so that it works, so that your functional movements get you to where you need to be without getting you hurt. And you need to learn that from yourself because you need to apply tactics, Pilates or core strengthening, things of that nature. And then understand the feedback from those tactics. You know, I really have a tough time when I hold the plank this way, etc. And then work on that so you're increasing your reserves in that area, so that when you have to call on it on a pinch because you have a ground ball coming at you, or you have to hurl a fastball, those all have to be recruited on an instant.
Mm-hmm.
And if you don't have that, that extra bandwidth, that extra reserve, you're going to tax it. And so if you have scoliosis, what I would recommend is really working on getting your core muscle strength and the muscles around the spine better. How do you do that? Well, Pilates, we talked about. And even just basic rowing, running, the things where you're increasing your heart rate, cycling, these are all going to help get the blood flow to your muscles, get your muscles active, and allow them to become more resilient. Because at the end of the day, resilience is the name of the game.
That, and one thing I've seen too. So I was specifically talking to a professional pitcher recently about this, and he does have scoliosis, and so he was just talking about some of the things that he's done too, in terms of, and there's weightlifting programs these guys all have, but little things that you can do, like he won't do a standard squat, he does it anteriorly loaded, right, or front loaded for those folks, so there's not as much direct pressure. Or if he's doing deadlifts, he's got blocks up higher, so he's not actually taxing himself as much on the low end. What other kind of, so even if you're maybe just a weekend warrior, right, not a professional athlete, but what are the kind of things that someone like me, right, I'm not suffering from it, but let's say that I was, like, what are some things that I can do to mitigate that, and just to make sure that I'm staying in the best possible shape so that I can avoid any issues down the road?
Well, I think it's a layered approach that you got to work on, right? And I think that if you keep it with the layered approach, I think it can really help you. The first thing is make sure your cardiovascular health is good, right? So check with your doctor, make sure your heart's good, your lungs are good, things that are working to get the raw materials, raw nutrients to the muscles are working well. Then I would say focus on your muscles. So what does that mean? Well, I would start definitely initially with cardiovascular training, because the more your internal cardiovascular system is working well, the more that system is primed. So work on getting your heart rate up to the 70, 80% level for 20, 30 minutes at a time, right? Do that 2, 3, 4 times a week if you can. If you can get to that, then I would start to incorporate cross training. Don't run every day. Maybe you consider bicycling. Don't bike every day. Maybe you consider swimming. Don't swim every day. Maybe you consider doing some type of additional HIIT workout. There are different types of, there's so many different variations of workouts that I think that would be helpful. Then in your individual workouts, I would pay attention to the stuff that bothers you and the stuff that doesn't bother you. And I would be mindful of making modifications of the stuff that bothers you. And here's the challenge with that, though, is that sometimes we do a workout and we don't really feel it for another day or two afterwards. You get that. So really, if you introduce something, really pay attention to whatever you introduced about 1 to 2 days later, because I think that will give you some ideas. And then another really good rule of thumb that I find is worth living by is don't make massive moves up. Like let's say you're running for 10 minutes, okay? Don't run for 20 minutes your next time. See if you can get only 5% better. If you can, then you add another 4% better. Then you add a little bit more. So you're stretching, but you never snap. Because if you do have scoliosis or you do have some challenges with your musculoskeletal health in general, the real issue is how do I stretch without snapping? And I think that these could be reasonable rules of thumb to live by that can be really actionable, because you have to make decisions in real time, right? You don't read a book while you're working out. You're making decisions as they come. And so it's good to have really solid rules of thumb to help you.
Awesome. And, I guess, and I appreciate your time. And I really, this is very helpful. I think even for, myself, I felt like I thought I knew what I was looking at and talking about. And this opens a lot of things up, but so again, we think about this, and I know we've mentioned this a couple times already, but in the absence, and now, a lot of things are opening back up and people are back in it, but we have lost a little bit of that awareness. So, outside of obviously just being able to take a kid into the doctor, whether it be for just their physicals, their annual checkups. And I think you mentioned, hey, something ain't right. Like, to parents out there, trust your intuition, right? If something seems different, don't be afraid to, I think, go check that out, because early detection is certainly one of the best things. But any other advice you've got out there, just as we've kind of gone to more of a work from home and we're not out there as much, and maybe kids aren't back in school all the time, whatever the case may be, what are some things that we can do as parents, as individuals, to just have a little bit more awareness of this and to make sure we're looking out for ourselves and our kids when it comes to scoliosis?
I think it's an excellent question. I think you answered the biggest thing right there, because whenever somebody comes to me, right, because I see patients all day, this is what I do, right? Whenever somebody says to me something ain't right, my antenna go up, and I know that I'm going to turn the ends of the earth up to find out what the problem is, because something ain't right always has gold in it for me, because that tells me that I got to make sure we check it every way we can to identify where things are. Outside of that, then you start to look into prevention, right? How can I make sure that I get myself so I don't get to the point where something ain't right? And how do I reintroduce myself now that I'm not wearing a mask? Because I don't know about you, but I have a tough time working out with a mask. You know what I mean?
Yeah.
So as we're getting there, and now that we're starting to potentially have less mask requirements, et cetera, some of us have this like, oh, wow, now I got to get back into it and really go gung ho. And that's probably not the best place to start. What I would recommend is go back to your workout that you were doing before and cut it in half. And just go through the first week, just feeling yourself out. Go to that point and see what you can tolerate. If you can't tolerate it, no big deal, right? You can build up to that. You can get there, but you need to make sure you get there in a safe manner, not a quick manner. Because quick and safe are not the same thing, and safety is the most important thing. So in my view, the way that you start to get to that area is you cut it in half. And if that doesn't work, you cut it in half again until you're at a point where you're like, all right, I think I got this. And then you start to build. And you build a little bit. And if it's enough, then you build again, and then you build again. Because at the end of the day, you're not going to lose but 1 month or 2 months at most in building back up to where you were, especially if you haven't been active for a year. But what you've gained in that process is a new awareness of where you're at. And then I can't underemphasize the role of nutrition. We become more aware of our diets and things of that nature, but we want to really try and make sure we put good fuel into our body so that we're taking care of whatever we have. Maybe we stay away from stuff that's packaged for us, if at all possible. I know it's convenient, but it may not be the best for us. So try and make sure we get good food, good nutrition, and make sure that that's an integral part of what you're doing. Because if you are stressing yourself in the gym or working out, et cetera, you need something to rebuild it. Because if you don't have the right stuff, you're going to have a challenge.
Absolutely. And I want to respect your time. I don't want to take too much more of it, but one more thing popped up to me. And this is, so, when and again, my daughter was seeing orthopedic surgeons from the time she was about 3 or 4 months old. We knew about this very early, right? But even knowing that, even being prepared for this for several years, the thought of, having my daughter undergo surgery, like, that was very scary for us. And there's a part of you that says, gosh, maybe we shouldn't do this. And obviously in her case, it was very necessary. But I think there are certain times when, we may not want to do something because we're afraid. We don't want to ask the question because we're afraid of what the answer will be, right? So I guess when it comes to, again, her situation, very, very rare, but what kinds of things, how frequently are people going to have to, undergo maybe some kind of significant treatment? Or is it primarily one of these where, most of this stuff is very, very simple, and most people can undergo just a little bit of, just change their habits and kind of do some better workouts, and that can help mitigate some of their issues. I want people to understand that, like, it doesn't have to be too scary for them. Just understand that you can kind of correct this the right way instead of putting it off because you're frightened of it.
Yeah, I agree. So let me give you a couple of things that I really rely on. About 80% of us, 80% of adults will have some level of incapacitating back pain at some point. Okay. Is that scoliosis related? I don't know, but those are the numbers. And less than a few percentages of us have to undergo any significant major treatment. So you have a significant gap between the likelihood you're going to have a problem versus the likelihood you're going to need significant issues. So what I think would be great is to use that initial scenario with the understanding that the likelihood of me having a problem with this for a long time is very low. But if I can clearly identify it, then the solution is going to be obvious. If I can just find out that it's just my muscles or it's just a small irritation, the solution is going to be obvious. I'm going to work on changing some basic things about my lifestyle. I'm going to make some basic changes about what exercises I incorporate. I'm going to make some basic changes about when I'm careful and when I'm not careful. I think these are all very, very important. And then whatever it is, time is like the best doctor and the best scientist because they know exactly what happens over time, right? Over time, things either get better or they don't. So a good rule of thumb that I use are the rule of twos. Think about it. In if you have like a cut, right? It takes about 2 days to get better.
Mm-hmm.
If you have like a bad bruise, it takes maybe 2 weeks to get better. If you have like a broken bone, it takes like 2 months to get better, as long as everything heals right. But if it ain't getting better, get it checked out because that's time telling you the truth. And that's where I think that that's where the this ain't right comes in, settles in, and stays in. And I think that that's why that instinct is such a great instinct that we have, and don't ever underestimate.
Awesome. Anything else that you have to share? Anything else you think the folks out there need to know? This has been awesome. Like I said, I think this is just it's the common sense part of it is so great because I think that's something some of us feel like we've got to have all these, all these ducks in a row and all these different checks. And a lot of it's just like, hey, just trust it. If it doesn't feel right, chances are pretty good that it's not. So go and it's like what we with anything, you're better off if you think something's wrong and you go get it checked out. And it turns out everything's fine. And it's just, it's a little flare up of something, who knows, than to think, oh no, it's fine. I don't need to worry about that. And then, 6 months down the road, you find out something's much worse. So, one
thing that I do suggest for folks is, because it's easy to say, don't be scared, but the truth is we're all scared. I'm scared. Yeah. We're all scared, right? So use your phone, use your calendar. If something's not right, put a reminder, check up on it in 2 weeks. If it ain't getting better, there's your answer.
Yeah.
Right? So you don't have to think about it because it'll weigh you down. It'll make you depressed. When it comes to you, we only have ourselves, right? So we all value what we do. We value what we do for ourselves, for our family, those around us. And we really want to be able to lead joyous, productive lives. We want to be able to, and we don't want to be bogged down in worry or concern, et cetera. And all of us have to deal with it in different ways. But I find that if you know that if something ain't right, if you know that the next step there is to go to your phone and make a reminder for yourself in 2 weeks and say, is what ain't right, is it better? Because if it ain't better, then I got to get it checked out. Then you've made a decision for yourself in advance, and it's going to make it easy for you to execute on it. Because when something's going horribly wrong, you got to get to the emergency room. But when it's going slightly wrong or slightly not on track, that's where you can talk yourself into anything. And that's where if you're good to yourself, if you're good to yourself today and you're good to yourself in 2 weeks, say, hey, by the way, check up on this. Now you've used nobody's time. You haven't complained to anybody, but you're taking great action. And so I find that that's a great tool that it's worked for me. So I figure I'd pass it along.
Absolutely. That's my big takeaway now from this is because I'm a little bit of a worrier in some of those things. So it is good to kind of do that, set it aside and let time tell the truth one way or the other. So that's awesome. No, I really, really appreciate your time. And I'm thankful for all this stuff. I definitely I look forward to getting this out there, sharing it with a few folks, because I do think there's a lot of really valuable information here. That again, I'm looking forward to sharing and just getting the word out as much as we can. So
much appreciated. If I could be of any help, please let me know. But our goal is to serve, and I'm glad you asked. By the way, the best part of this is you asked all the right questions.
Yeah. It's like I said, it's a little bit easier, and Olivia provided a nice little template there, so it was great. But like I said, having gone through it, and seen that, and the after effects. I know it's not something that most people have to deal with, but the coolest thing for me was afterwards, my daughter was on several different medications because her trunk was so compressed, that, you know, just her esophagus, her stomach, just a lot of reflux and various digestive issues instantly gone. I mean, just done with all that.
It's like life changing, right?
Yeah.
It's life changing on both ends, but it is so scary. I mean, look, I mean, my heart goes out to you. I mean, but this is why I do what I do, because I want to make sure that we serve folks, right? I mean, at the end of the day, you know, so I mean, I get it. I mean, kudos to you for handling it as well as you did.
Yeah. Thank you. I appreciate it. Like I said, it's close to us. So again, I appreciate what you're doing out there for so many other folks. I know how important that was for us, and how having capable, doctors, nurses, and all that staff there just to help us through that whole thing. And it was, like I said, it was amazing. She's in the hospital for however many weeks, and then 3 days later, after it's done, it's like, okay, she's walking and, up and going. And it was just like, wow, after she got past all that, and then her life changed immeasurably. So it's just, it's incredible. So again, I really thank you for your time. And Olivia, thank you for setting this all up and helping to facilitate it. This has been awesome. I just hope you have a great rest of the afternoon. I'll look forward to getting this put together and put out there on a bigger platform for us.
Sounds great. Much appreciated. If you need anything, let me know.
Thank you.